Hi, I'm Frank Fisher, and I'm the Managing Director of Decatur Ear, Nose, and Throat Physician Hearing Care. Today we're going to talk a little bit about the evolution of hearing aids. So, let's go back about 6,000 years. First hearing aid, the cupped hand. Didn't last too long because it didn't work too well. So mankind found other ways of increasing hearing by rolling up leaves or finding devices that they could stick in their ear, which later became ear trumpets or ear horns. By the late 1800s, companies began working toward an electric hearing aid or an electet microphone type hearing aid. Around that time, hearing aids were big, bulky, usually came in a giant box and sat on a table with a set of headphones. Acousticon was one such company. Some of you may remember relatives that had one of those. It wasn't until the 1960s when we started to see hearing aids improve a little bit. Some of you may remember Uncle Joe or Aunt Melba with the traditional BTE. This particular style hearing aid was basically a very loud amplifier that consisted of a volume control, a battery door, and an ear hook to hang over the ear. There had to be an ear mold attached to this that held it in the ear, which made it bulky, uncomfortable, and unsightly. So it's a good thing that these only lasted about 25 or 30 years. By the late 60s, people were looking for a better fitting hearing aid and a better looking hearing aid. Custom hearing aids were designed. One of the first custom hearing aids was called the ITE, or the in the ear. This particular hearing aid was made by putting a mold into the actual outer ear, letting it set up, and then taking that mold and making an exact replica of that patient's ear. Thus, you have a made-to-fit hearing aid. The in-the-ear was the first, and it was much smaller. It allowed the microphone to sit inside of the ear rather than outside, which did reduce wind noise, ambient background noise, and it was easier to get in and out of the ear. It was big, it was bulky, and it was a bit unsightly, but compared to this, it was a pretty big difference. It wasn't too many years down the road when they started to shrink the custom hearing aids down, and we began to see smaller hearing aids, such as the ITC or the canal aid. This particular hearing aid was an easy insertion as well as an easy removal. And by going with a smaller hearing aid, this allowed us to put the microphone deeper into the patient's ear, thus creating less wind noise, less ambient noise, and a better looking hearing aid, which everybody liked. And by 1991, manufacturers all over the world had started working on what they called invisible hearing aids, or CICs, completely in canal. This is one such device. This is a completely in canal instrument. If some of you remember, President Reagan had a bad hearing loss and was usually seen in public doing this. When he was one of the first people to be fit with this particular hearing aid, the CIC, it made world news. It also turned the hearing industry upside down. These hearing aids were, at that time, the smallest, most comfortable, and most efficient little hearing aid there was. It allowed people who had vanity issues to wear a hearing aid without others to know about it. It allowed people like golfers and fishermen and outdoorsmen to be outside and to deal with the wind noise problems that they normally had with bigger hearing aids. The only problem was the battery life. Generally about 4 days on a battery, but people were willing to give that up for the vanity issues, for the clarity issues, and for the background noise issues. Some of the problems associated with custom hearing aids over the years, such as these three devices here, were basically feedback. And for those of you who don't know what feedback is a horrible piercing sound that annoys the wearer and anyone that is near the wearer. Just a loud whistling noise. Feedback occurs when a hearing aid does not fit comfortably in a patient's ear. It is either too big or too loose. You see, the ear is forgiving. It will change. It's made of cartilage and skin, and it moves. Hearing aids are not forgiving. They are hard, and they do not bend. That is why something had to change over the years. Over the years, many companies tried to go back to what we call behind-the-ear devices, like what we talked about earlier, but did not do well. They were still bulky, big. People did not want them. In the 1990s, there was a small company from Redwood, California, that created a hearing aid called an Avance. It was one of the first open-fitting, open-air hearing instruments. Sadly, it faded away and didn't make it. And I remember fitting some of those, and I thought, what an incredible idea. And it wasn't until almost 20 years later that the companies reinvented their energy and their time into developing a small behind-the-ear hearing aid. At first they were open and the speaker was inside of the hearing aid, but quickly they changed to a receiver on the outside of the hearing aid, such as this hearing aid here. We have the portion of the hearing aid that goes into the ear, and of course we have the body of the hearing aid. These instruments are basically one of the most comfortable, one of the most sightly, and studies every year are showing they tend to be beating custom hearing aids in almost every way, stage, and fashion. From less feedback to a more comfortable fit, less barrel effect from the patient. One thing custom hearing aids do to patients is they plug the ear canal. So when you plug an ear canal, your voice immediately takes on a barrel effect. Open-fitting hearing aids pretty much got rid of 90% of the barrel effect. So patients were immediately able to put their hearing aids in and go, wow, this sounds very natural. So we knew we had a winner when that came out. Over the last several years, all of the major companies have went to this technology. The difference, one of the main differences I think between custom hearing aids and receiver and canal hearing aids is we have placed the microphones back outside of the ear. So in most cases people would say, well, you're destroying the resonance of the ear, you're changing how sound is. Well, there was some issues there. Most of these hearing aids now use 2 microphones, not 1. And this is called directional versus omnidirectional hearing. What that allows the patient to do is to literally shut a back microphone off and focus like a flashlight in front. So when 2 microphones are on together, it is much like a lantern. It shows from all sides. But when just 1 microphone on, it is more like a flashlight focusing on what the patient wants to hear, whether that is a waitress at a restaurant or a friend at a church or any noisy environment that there is out there. Also during this time we have developed technology for wireless communications, Bluetooth technology, remote controls, streamers. We even have remote controls that look like your regular pen. So you can be sitting in a meeting and adjust your hearing aid and no one has a simple idea what you're doing. What we're seeing for the future of hearing aids is many different things. At this point in time, I think one of the most advanced companies would probably have to be Siemens Technology. And the reason I say this is currently they are the only hearing aid that the only hearing aid manufacturer that make an underwater hearing aid that you can shower in, swim in. They are also one of the few companies that have completely rechargeable hearing aids, thus eliminating the use of regular batteries or the cost associated with regular batteries. Other companies are looking at implantable devices now, and some of these have decent track records, some have horrible track records. So when considering any type of implant other than a cochlear implant, which is a medical device, be sure to ask your doctor and find out if you are a candidate for that. There have many people that have fallen for the invisible hearing aid and we're really not candidates. So you want to check the criteria as far as being a diabetic or being on blood thinners or other issues with the physical attributes of the ear. One day we would like to see a cure. A simple regeneration of hair cells for the cochlea or the inner ear as it's called. And if we can ever get to that point, then we can finally get rid of hearing aids. But for now, we're going with the Rick hearing aid. Thanks.